Hey, I'm Kara Bradley. One of the role competencies and established expectation for the advanced practice nurse is expert coaching and guidance. In order to manage chronic diseases, promote healthy lifestyles, and emphasize early intervention, it is crucial for the APN to implement patient education, guidance, and coaching. Guidance is the act of providing counsel by leading, directing, or advising. APN guidance is a style and form of communication informed by assessments, experiences, and information that is used by APNs to help patients and families explore their own resources, motivations, and possibilities. APN coaching is defined as a purposeful, complex, dynamic, collaborative, and holistic interpersonal process that is aimed at supporting and facilitating patients and families through health-related experiences and transitions to achieve certain goals. The goals are mutually determined and include higher levels of wellness, risk reduction, reduced morbidity, suffering from chronic illnesses, and improved quality of life. Patient teaching and education is often incorporated into guidance and coaching. Patient education involves helping patients become better informed about their condition, medical procedures, and choices they have regarding treatment. Education is important in order to enable individuals to better care for themselves and make informed decisions regarding medical care.
Hey, I'm Kelly Phillips. HAMRIC's integrated model of advanced practice nursing consists of critical environmental elements affecting advanced practice nursing, core competencies, one central competency, and primary criteria. Within the spherical model, primary criteria serves as the core and consists of graduate education, certification, and practice focused on patients and family. Direct clinical practice is the primary core competency and serves as a foundation for the other 6 competencies. Guidance and coaching is included as one of the other 6 competencies, which also include consultation, evidence-based practice, leadership, collaboration, and ethical decision-making skills. HAMRIC's model also includes critical environmental elements, which include regulatory and credentialing requirements, business aspects, health policy, payment mechanisms, outcome evaluation, and performance improvement, marketing and contracting, and organizational structure and culture. Guidance and coaching is a reflection of all characteristics portrayed by the direct clinical practice competency.
My name's Ryan Hurley, and I'm going to discuss the characteristics and traits of guidance and coaching. The concept of transitions and the conceptualization of transitional care are pivotal aspects encountered by the patients that extenuate the need for guidance and coaching. Transitions have been defined as the passage from one life phase, status, or condition to another. Transitions refer to both the process and outcome of person-environment interactions. The 4 types of transitions are developmental, situational, health and illness, and organizational. Developmental transitions emulate cycle transitions such as adolescence, parenthood, and aging. These developmental transitions, from an APN coaching perspective, are considered to include any transition involving an interpersonal focus, including changes in self-perception, expectations, or motivation. Situational transitions usually include changes in family roles, work, or education. These situational transitions can also include changes in resources, such as financial reversals, and tangible or abstract structures, such as loss of a relationship. Health and illness transitions are typically viewed as illness-related changes and include adapting to an acute injury or possibly a chronic illness. These transitions may also include adaptation to non-illness types of health issues such as physiologic and psychological demands of pregnancy, changing unhealthy lifestyle behaviors, and reducing risk factors to prevent illness. Organizational transitions are those which occur in the environment, between agencies, within agencies, or in society. These transitions reflect changes in resources and structure at a systems level. Developmental health and illness and situational transitions are the most likely types of transitions to lead to clinical encounters requiring guidance and coaching. In order to effectively communicate and help navigate the patient through their transitions, proficiency in guidance and coaching is essential. Characteristics that describe the essence of guidance and coaching include technical, clinical, and interpersonal competencies in combination with self-reflection. These four elements work together simultaneously to promote competency in guidance and coaching. Graduate level education and enhanced knowledge and skills in combination with prior experiences and continued education are factors that help promote technical competence. Clinical competence is achieved by providing holistic care using knowledge from prior experiences, using intuition and clinical decision making. A holistic perspective requires the advanced practice nurse to be aware of the meaning associated with the experience from the patient's point of view. Through experience in diverse situations, the advanced practice nurse develops techniques to educate, direct, manage, and care for a patient. As patterns in clinical experience emerge, the advanced practice nurse develops a sense of knowing or intuition that guides the course of action. Clinical competence is acquired not from textbooks but from experiences.
Hello, my name is Erica Brumley. Interpersonal competence includes establishing therapeutic relationships, providing patient-centered care, familiarization with the patient, understanding the feelings of others, being culturally competent, using effective communication skills, and motivational interviewing. These components set apart the guidance and coaching performed by the advanced practice nurse in comparison to the staff nurse or other professionals. Therapeutic relationships are essential to promote self-management of care, shared decision-making, and to provide holistic care and provide continuity in care. In order to develop a relationship with the patient, the advanced practice nurse must be aware of his or her feelings and values and have an understanding of how those feelings and values may influence the relationship with the patient. In order for the advanced practice nurse to effectively guide and coach the patient, good communication skills such as introducing yourself and your role, maintaining eye contact, using proper tone of voice, maintaining proper body language and posture, allowing periods of silence, and minimizing any environmental stimuli that could hinder communication affect the overall outcome. In addition, the advanced practice nurse must avoid being judgmental about the patient or family's appearance, behavior, or background. By establishing a therapeutic relationship and maintaining good communication with the patient, trust is developed. The quality of care the patient received is enhanced. The patient is more likely to be satisfied with the care, and the patient is more likely to be compliant with the treatment regimen and follow any given guidance or coaching. Knowing the patient or familiarization with the patient means the advanced practice nurse is aware of physiologic, affective, cognitive, behavioral, social, spiritual, and environmental factors that positively or negatively influence the patient. This personal knowledge aids in providing individualized care, which fosters transformation. Motivational interviewing is an approach used to enhance the patient's awareness and eagerness to change behaviors. Through motivational interviewing, the advanced practice nurse is able to uncover hindrances as well as reinforcements. Motivational interviewing techniques includes using open-ended questions, affirmation of positive behaviors, reflective listening, and summarizing the encounter with the patient. Motivational interviewing is used to empower the patient. Lastly, in order for the advanced practice nurse to grow and learn, the nurse must self-reflect. There are two ways to self-reflect. Reflection in action occurs when the advanced practice nurse makes observations of the experience while the experience is occurring. On the other hand, reflection on action takes place after a situation has already occurred, and the advanced practice nurse examines behaviors, interventions, and outcomes. Technical, clinical, and interpersonal competencies, in addition to self-reflection, are characteristics that are essential for guidance and coaching.
We will now discuss examples of expert coaching and guidance. Expert coaching and guidance are used in APN practice for things such as managing chronic illnesses, transitions in health and illness, and promoting healthy lifestyles. The following is an example of anticipatory guidance in primary care. After doing a health history on a young woman, a nurse practitioner obtained information about binge drinking that was a concern. She asked the woman if she knew about the effects of alcohol on the body, and the woman replied no. The NP then asked if the woman would like to learn about the effects, and the patient replied yes. The visit proceeded with a brief overview of the effects of alcohol and provision of more resources.
My name is Keith Amick, and I'll provide additional examples of guidance and coaching in APN practice. First example would be an expectant mother with her first pregnancy. MP would question the patient about fears and concerns about this pregnancy, question the patient if they have ever had CPR or first aid training of any kind, provide resources for free CPR and first aid training for expectant mothers, provide resources for first-time mom for training available to them if needed, review different birthing options, provide referral information and other educational options as needed. Another example would be a teenager newly diagnosed with asthma. MP would question what worries them most about their illness, question the patient if they would like to know ways to help them improve management of their illness, provide educational resources, encourage them to limit excessive stimulation during an attack, discuss treatment options and referrals as needed, and reassure the patient that with time and proper treatment, that asthma is a manageable illness and normal life is possible. Final example would be cancer patient with a terminal diagnosis. MP would question the patient about their wishes for life support, question the patient about having a living will in place. Have they discussed end-of-life issues with their family? Recommend developing a living will, provide referral options as needed, and recommend discussing end-of-life issues with their family, and assist with establishing paperwork as needed.
Hi, my name is Charlene Sullivan, and I'm going to talk about what does the current research say about the outcomes of expert coaching and guidance when used by advanced practice nurses. The research is limited, but positive correlations have been achieved when advanced practice nurses directly manage the discharge process and provide home care post-discharge. The population at the highest risk for readmission are elders. The highest risk is in transition because of their complex health issues, complicated disease processes with poor self-efficacy and poor management skills. Carroll et al. Collaborated on an article documenting interpersonal interventions of APNs on positive behaviors post-discharge. The population sample size was 44 single, widowed, divorced elders post-discharge after an MI. The determining factor of positive behaviors post-discharge was self-efficacy or judgment of their own abilities. The APN's goal was to improve the self-efficacy use it to improve positive behaviors after discharge using mastery, social modeling, and social persuasion. The discharge preparation included education, coordination, as well as coordinating the follow-up appointments with the physician and using community resources as needed. After discharge to the home, the advanced practice nurses used direct care, coaching via telephone daily if necessary, assisted weekly goal setting, psychological support such as what was most important to the patient, and positive reinforcement. The length of this program was 12 weeks. The data collection tool that they used was a nursing intervention telephone data form where the nurse documented various assessments. They also measured self-efficacy activities and measured their goal achievements. The validity was established using several methods, and 4 themes were used by the APNs, and those 4 themes were patient education, validation and feedback, encouragement and support, and problem solving. The results of the study indicated that many of the participants valued the relationship with the advanced practice nurse and thought that it was a great resource and a key determinant of their post-MI recovery success. Naylor et al. Published a randomized clinical trial where APNs completed a complete discharge plan. The APN activities were assessments, tailored interventions to increase self-management skills. They collaborated with interdisciplinary teams. All health issues with comorbidities were addressed. The data analysis showed that after enrollment in the study, the control group had 760 days of hospitalization after they were originally discharged, and the treatment group had only 270 days of hospitalization after the initial discharge. Macaulay et al. Also published a randomized controlled trial involving elders with CHF. The primary purpose of the study was to find out if the interventions of the advanced practice nurse could prolong the readmission time. Typically, the readmission time for these heart failure patients was usually a 30-day period, which just lasted past the 30-day home visit intervention. The methods that they used were the APNs, and these were APNs with significant heart failure experience. They managed these patients directly after discharge. They immediately visited them on discharge in their home and weekly thereafter. The home care intervention was extended to a 90-day intervention period versus a 30-day period. The APNs focused on patient-caregiver effectiveness, patient-provider relationship, management of comorbid conditions, and improving overall health. The results of this particular study, through the APN guidance and coaching, this extended the length between readmission rates as long as 52 weeks versus the original 30 days.